All right, good afternoon. My name is Matthew Wright. I'm a student physical therapist from the University of St. Augustine. How you doing today?
Doing pretty good.
All right, so today we're going to be kind of doing an abdominal screening. I know you have that right side pain, so we're going to kind of be just inspecting the whole abdomen just to see if there's anything up in that area. So first, we're going to have you lay down, and I'm also going to have you roll up your shirt. Is that going to be all right with you? I'm just going to expose the abdomen. We're going to use a little drape over the top. That sound all right?
That's fine.
All right, if you could lay down for me. All right. So, from here, I'm going to just drape this over you. We're going to roll up your shirt, is that okay?
Mm-hmm.
Okay. From here. Good. All right, so first we're going to start with a little inspection. I'm just going to make sure there's no discoloration of the skin, no protrusions. First thing we're going to move into is auscultations. So I'm just going to be listening to your stomach, just listening for normal bowel sounds, okay?
Mm-hmm.
So make sure the large bowel is the one that is open. Warm it up for you. So we're going to start in that left upper quadrant, listening for sort of those digestive noises. There's going to be sort of a gurgling noise, kind of like a leaky faucet almost. We're looking to hear about 5 to 34 noises per minute. Below 5 would be a hypoactive bowel, and above 34 would be hyperactive. That was 30 seconds. I heard about 12 there, so times 2 would be 24. Now we're going to move on to the lower left quadrant. All right, and that was 11 there, so times 2, 22. Now right lower quadrant. All right, that was about 12 again, so that was 24 for the right lower quadrant, and then we're going to finally move to that right upper quadrant. If you're finding an absence of bowel sounds, in order to kind of make sure, it'd be important to go into that right lower quadrant and listen for about 2 to 5 minutes just to confirm that there's an absence of bowel noises. All right, so that was 10, so it was 20 for the full minute, so 20 sounds per minute. Now that that's all normal, we're going to move on to auscultation of the abdominal vasculature. So we're going to start at the abdominal aorta. We're kind of just really listening for any bruits. So bruits would kind of sound like a swishing noise almost, where that kind of means there's turbulence within the artery and will be indication for any sort of arterial pathology. So starting at the aorta. Okay, nothing really there. Then we're going to move to the renal artery, so just above the umbilicus on both sides. So on that right side first. You might hear some of those digestive noises as well as you're doing this, but we're really listening for that bruise. Okay, then iliac artery on both sides, just below the umbilicus. Okay. And then even further down, we'll go for the femoral artery. So right about here. All right, so now that we're done with auscultation, I'm going to move on to a percussion of the quadrants. So with percussion, we're kind of listening for different sounds depending on what organs we're over, kind of what area. So we're going to start with the left upper quadrant. I'm going to use my left hand as sort of a dummy hand, and I'm just going to be tapping on that middle finger there using my right hand. So you might be able to hear that. We're kind of over the stomach, that sort of gastric bubble, which is more a very distinct tympanic noise. Then as we move down, kind of into that left lower quadrant, it's still tympanic, but it gets a little bit less distinct as when we were over the stomach. And then we're going to start up here in that right upper quadrant. We're going to start. This should be around where the liver is. So here we should be hearing that sort of duller noise. So I'm going to kind of find the top of the liver. I'm going to look for his kind of mid-clavicle line. So we're going to start in line with the mid-clavicle. And we're going to find where that dull sound sort of starts. Right about here. And then as we do it, we're going to come down following that line until that dull sound sort of stops right about there, just to see the size of the liver. So with that, as we move into the right lower quadrant, with that, it kind of measures just the size of the liver. We're kind of looking for it to be about 6 to 12 centimeters. Any bigger than that could kind of indicate inflammation of the liver. So now that we've gone through the percussion, we're going to move on to palpation. So with palpation, we're going to start with a light palpation. It's important to kind of remember to start away from where she was feeling pain. So the patient was feeling pain along her right side, that right flank. So we'll start with that left upper quadrant to start. We're going to start with a light palpation. So we're just going to come in using the tips of our fingers. We're going to do sink in about 1 centimeter and rotate down to the left lower quadrant. So with this palpations, you're kind of looking for any sort of tenderness, any guarding by the patient, kind of reaction to it, any firmness or any firmness or any rigidity in the area. So now that we've gone through with light palpations, we're going to go a little bit deeper with our deep palpation. So using 2 hands, we're going to sink in about 4 centimeters, rotate. It might be a little bit uncomfortable for you. Just let me know if you feel any pain or any of those symptoms are elicited, okay? We're going to go left to lower, right lower, and then right upper quadrant. So right in there, we should be feeling some pain. So with this case, they've had that pain in that right upper quadrant. That could indicate possibly involvement of the liver, inflammation of the liver, inflammation of the gallbladder there. Also deep in there, we have the right kidney as well as part of the colon. So with that right upper quadrant pain, I'm going to move on to kind of further investigate it. So I'm going to move on to my special test. So for my special test, I'm going to look more at the right kidney. We're going to do the Murphy's percussion test. So with that, I'm going to have my patient sit at the edge of the bed for me. We're gonna leave that shirt kind of up. So if you wanna swing over for me. Thank you. Move that if you'd like. And then with this, so can you scoot up just a touch? Perfect. So with this, we're gonna find the kidney here. I'm gonna place my left hand over the kidney there and make a fist with my right hand. And for this, on the left side, we shouldn't feel any pain, any symptoms with it. So I'm gonna percuss it with the ulnar side of my fist. So coming here, do one more. All right, and now I'm gonna come over to the right side here. And with this, as I make contact with my fist, they should be kind of eliciting those symptoms, maybe that whole right flank pain or even just pain specific to the kidney there. So that's a positive sign for Murphy's percussion on the right side. So that's a physical exam portion of this exam. So from here, I'm going to move on and kind of go over my hypothesis for a possible diagnosis.